Hello friends, welcome to Medicate Hub. Today we seeing topic about VA-ECMO, that is Veno-Arterial ECMO. So what is VA-ECMO, what are the indications and what are all complications, how the weaning and dig and letters. So this and all we will see in these topics. Before going to the topic, I will say one small story. So you all know about crow, okay? So that one day that crow went to God and cried, I am black, so all ignoring me, no one like me, I will go and die like that. Crow is crying. God says, okay, you go and ask that eagle. If that eagle said okay means I will make you as a eagle. So the crow went and asked that eagle, eagle, you are flying height and you are a king of birds. So I want to become like you. So for that eagle said, that is a matter because I'll be alone only. So be alone is no usage. See that parrot, it's a happiest bird and it's a colorful. You go and ask that parrot. So crow went and asked that parrot, you are the happiest bird and you are more colorful. So for that parrot said, it's a matter because I'm colorful, so I'll be in cage only. There is no freedom for me. So see that peacock. The peacock is colorful and it's a national bird. Be happy. Go and ask that peacock. So the crow went and asked that peacock. Peacock, you are a national bird. You are more colorful. I want to become like you. So for that peacock said, that is a matter because you can see me in zoos only. I am not in any forest that tunnel you can't see. So what I think means you are the best bird because no one keep you in cages and all. You can fly as in freedom. So that crow went and said to God, I'll be like this only, don't change me like that. So moral of the story is there is no unnecessary compassion, don't keep. Okay. Be a be a talented and be yourself. Okay. Don't compare to others. Okay. Be positive and do your work. Okay. Okay, now we will go to the topic. Why Veno-Arterial ECMO? What is Veno-Arterial ECMO? So Veno-Arterial means ECMO. So what are the indications we will see? So the content is introduction of VA-ECMO, indications of VA-ECMO, cannulation sites of VA-ECMO, management of VA-ECMO, complications of VA-ECMO, outcomes of VA-ECMO, weaning protocol of VA-ECMO. So first we will see introduction of VA-ECMO. First we will see definition. Okay. Veno-Arterial extracorporeal membrane oxygenation. So that is VA-ECMO. It's a life-saving medical intervention used to critical heal patient with a severe cardiac and respiratory failure. It involves a temporary extracorporeal support for both the heart and lung by routing a blood from large vein through a oxygenator and add oxygen and remove carbon dioxide before retaining the large artery. So to circulate throughout the body. So VA serves as a bridge to recovery by providing a temporary support while allowing the heart and lung a rest and heal. So what they're saying here means, so VA is used for most critically ill patients like severe cardiac or respiratory failure patients, and it is a temporary support for support for heart and lungs to heal and keep it rest. Okay, so what it will do means it take a blood from large vein, that is femoral vein, and it can send to oxygenator and it will be get oxygenated and remove the carbon dioxide and return to the large artery, that is femoral artery. So it circulates to the body. So like this the VA-ECMO will be works. So what are the indications of VA-ECMO? First, a VA-ECMO is used to both respiratory and cardiac support. Yeah, that's correct. So before only we read for cardiac or respiratory failure patients, we will use this VA-ECMO. And the cardiac conditions with the low cardiac output, cardiac index is less than 2 liter per minute, and the hypotension of systolic BP is less than 90 mmHg, despite the inotropic or intra-aortic balloon pump support. So in that cardiac condition, the low cardiac output one will be there. So the cardiac index is 2 liter per minute like that, and the hypotension of systolic BP is less than 90 mmHg. So like these patients of intra-aortic balloon pump support, so like these patients can take as a VA-ECMO. A cardiogenic shock is a secondary, it's either acute coronary syndrome, refractory cardiac arrhythmia, sepsis leading to cardiac depression, myocarditis, pulmonary embolism, drug toxicity, cardiac trauma, anaphylaxis, acute decompensate heart failure, septic shock, where a cardiac act compressed and unable to pump out adequate blood to meet a body damage, so body demand. So this type of conditions, people we can make a give as a VA-ECMO. And post-operative cardiac failure. So after the cardiopulmonary bypass surgery, so the ECMO is useful for post-operative patients to rest the heart and help to recovery after surgery also. And post-heart transplant patients. So after the heart transplantation, there is a case of primary graft failure will be happen. So for that also we can use VA-ECMO. And it's a bridge to long-term VAD support or a bridge to heart and lung transplant patients we can use. So VAD means ventricular assist device, and it's a pre-procedural for high-risk cardiac intervention patients we can use. So what under condition where under they will can put in that patients. So they take a divide into two canalizations. That is, one is peripheral canalizations, one is central canalization. So in peripheral canalization, first femoral vein to femoral artery, and femoral vein to axillary artery, and intrajugular vein to carotid artery, and intrajugular vein to axillary artery. In central cannulation, there are two types: aortic to right atrium and aortic to biclavicle. So how we will be managing the patients in VA-ECMO patients? First, initial assessment, that is hemodynamic instability, ABG, and how is cardiac output and preload. This and all we will see. Next, cannulation and initiations. So we want to put a cannulus, which is the best sites to put a cannulation and how they will put. So this and all we want to management. Next, hemodynamic monitor, and you want to check their pulse, saturations, BP, ABG, and this and all we want to check. And ventilator management. So anyway, lung also will be rest. So but we want to give some support for the ventilator. Before video I said, for 2 days also I said like that. Okay, who are not trying that before 2 videos, I'll give a link in description, you can see. And anticoagulation management, because of there is in tubes there is no clotting want to happen. So for the anticoagulation management you want to do, and fluid management want to do, you want to give fluids for them, and organ supports. So we want to check the organ is supporting for the VA-ECMO or not. And complication management. So what are the complications I will say later. Okay, but we want to stop that complications. Okay, and weaning and decannulation, and we want to give a rehabilitation for the patients. Okay, and complications of VA, what and all complications will come? The same like a bleeding and thrombosis. Infections can happen for that patient easily, and hemolysis can happen, and sometimes a circuit can be malfunctions, it will not work, and organ disinfection. So sometimes some organs, not only heart or lung, some organs can be disinfection, and vascular complications can be made, and metabolic disturbance also can come, and complications are related to immobilization. So we not mobilizing, we can't mobilize that patient, so using that immobilization some complication can be happen. And psychosocial complications. So we want patients party can ask what happened. We want to explain them clearly what is ECMO about and all. So this can be happen. And what are the outcomes of VA-ECMO? How there is some outcomes in VA-ECMO. First is survival and recovery of organ function, and neurological outcomes, and quality of life, and long-term survival and morbidity. And weaning protocol of ECMO. How they weaning from ECMO? First, the initial causes of cardiogenic shock must be resolved and be corrected by weaning a VMO. First, we want to say that the cardiogenic shock want to be resolved, and the period of VA-ECMO. Okay, so depending on initial VA-ECMO initiations, and the weaning process will start different time and different disease process. So it will not same way. Some patients it will be different, and they will make a different strategy as individual plans and all. So next, if we are trying being to winning a trial, okay, so that time the patient map should be less greater than 70 or without inotropic or device output want to be. Okay, next, low vasopressor inotropic support want to be low, and oxygen saturation greater than 95%, and central venous oxygen concentration must be greater than 70%, and normal ventilation and oxygenation of patient lung want to improving. We can see in a chest x-ray, and echocardiographic data of ejection fraction will be greater than 25% to 30% want to be. So this is a normal we want to see before weaning the ECMO. Normal parameters we want to see before weaning the ECMO. And weaning started to reduction and overall pump flow on the ECMO circuit. So now we reducing the pump flow and all. Next, a patient need to have a inotropic drugs at a reasonable level or support. If they using inotropic, this and all means it want to be in a reasonable level for their support. Okay. Now the patient may have aortic balloon pump or left ventricular device was placed and added support. So now we want to keep a aortic balloon pumps and devices and all we want to use, and weaning attempts can be started and mention drugs and devices places. So after that we can start a weaning trial, and some centers they recommend removing of left ventricular support device. So some centers they will recommend to remove the left ventricular support devices they saying to remove. Next, when the pump is slowly retreated down, the patient will start to develop a more preload, and the heart will monitored and how well the left ventricle can eject. So now the pump is slowly titrated down. So that time the patient's preload of heart will be start, and we want to monitor the heart and left ventricular ejection over it. So we want to see that. Next, each time of ECMO flow level is decreasing. So every time we will decreasing the level. So the cardiac function should be continuously monitoring using echocardiography, and non-invasive cardiac function monitoring can be used, or a pulmonary artery catheter can be placed in the monitor second to second and cardiac function changes. So now the invasive cardiac monitoring can be used, or any pulmonary artery catheters we placed and monitor the patients second by second of cardiac function will be changed in that. It's strict attention to the ventricular settings. So we want to ventricular settings want to be strict, and respiratory support want to be there. So always we want to say that, and pulmonary blood flow will significantly increase, and change your PEEP and tidal volume settings. So we want to change the tidal volume PEEP when the pulmonary blood flow is significantly increased, and we want to make a ventilator settings all will be perfect. Next, now the maximum flow on the majority of ECMO machines is around 6 liter per minute. Yeah. So when they starting a ECMO machines for the patient, so it will make a 6 liter per minute only they will keep. So when we weaning a VA ECMO, we recommend to weaning at an increment of 0.5 liter to 5 liter per minute to 1.0 liter per minute changes when they are decreasing the flow. So when we decreasing from 6 liter, no, so we want to decrease at 0.5 liter to 1.1 liter per minute we want to decrease, and mention you will not, the flow rates should not below 2.0 to 2.5 liter per minute, because it will cause a clotting and in the cannulus and circuit. Yes, each time when you decreasing the flow, the rate should be maintained at least 60 minutes to monitor the patient comes out. So once if we reduce 0.5 liter, if we reduce means we want to monitor the patient at least 60 minutes. So if a patient shows any signs of failure in adequate cardiac output, or signs of inadequate tissue perfusion, and increasing a blood lactate level, or any echocardiographic findings of ventricular disease, should promote the physicians to place a patient back to the full support and monitor the patient recovery cardiac function and full ECMO support. So if like this any signs we will see means we want to put the patient back to the ECMO support only. So when weaning from a VA-ECMO, a patient shows a stability of left ventricular ejection fraction is greater than 25%. So before only I said the normal ejection fraction is 25 to 30%. Okay, so the left ventricular ejection should be in 25% and normal cardiac index want to be greater than 2.5 liter per minute. This is the good sign of ECMO weaning. So this another will see first. Now we will see the patient signs of hemodynamic. If the patient is unstable or any signs of distress of any time, the patient change to full ECMO support. Then the monitoring of transesophageal echo or transthoracic echo when weaning. So we need to look at signs of rising left or right side filling pressures and progressive ventricular dilations, and worsening or new signs of mitral or tricuspid regurgitations, any signs of hypoxic or hypercarbic of an arterial blood gas, any signs of ventricular changes in elevated peak pressure or plateau pressures, and also look at signs of increasing vasopressor support in the patient signs of hypertension of MAP less than 60. So in this what they're saying means any in hemodynamically unstable or any signs of distress system, you want to put patients in a full ECMO supports, and you want to monitoring a transesophageal echo and transthoracic echo when weaning. And also we want to see the signs of rising left or right side blood filling pressures, and progressive ventricular dilations, and worsening a new signs of in mitral or tricuspid regulations, any new signs or anything there are, and hypoxic or hypercarbic or that in arterial blood gas we can see that, and any signs of ventilator changes in elevated peak pressure or uh, plateau pressures. So this and all we want to see, and the map less than 60 means we want to put back in the patient. Okay, next we will see about the once the patient have completely weaned from the ECMO circuit, the hyperinfusion can be stopped and the pump flow on the ECMO machine will be raised. So when the patient is weaned from the ECMO circuit, so that time we want to stop the heparin infusions and the pump flow want to be raised because to avoid a clot accumulations. Okay, and some institution what they will administer the positive inotropes at this time. Why means to facilitate the cardiac output after the cannulus has been clamped. So to facilitate the cardiac output, so they give us positive inotropes, and the patient is deemed liberated or weaned from the ECMO support at this time, and the patient can be decannulated from the removal of cannulus. So after this, the patient can wean from the ECMO support at this time, and they will remove the decannulations of the cannulus. Okay. And this could be bedside if the percutaneous placement of the cannulus was performed. So if any percutaneous placement will be there means they will do at a bedside, or if any central cannulations or surgical cut down will be there means they remove the cannula from the operation theatre only. And okay, now patient weaned from the ECMO support will completely weaned. What and all we want to monitor a patient means cardiac output we want to monitor, oxygen saturation level, lactic acids level, pH, urine output, and ventilator settings. This all want to be confirmed with the patients, and the maintain of perfusion of other organs. There's a perfusion will be going correctly, or we want to see that and all. Next, after liberating a patient ECMO support, a patient has sometimes signs of inflammatory response requiring increase of inotropic support. Sometimes a patient can have a signs of inflammatory response. So at that time we will increase the inotropic support, and this is not common for weaning of ECMOs. Okay, that's it, friends. Please, thank you. So this is the first video in my English. Is there means can you comment me? I will rectify from the next video. From this video onwards, we will take a class on English only. Okay, subscribe our channel, like, share, and comment our channel. Okay, we are doing one subscribe only for me motivation for a next video. So thank you, friends. Have a great day. Bye.